Hello, I'm Erin Frith, a veteran educator and member of the AXYS Board of Directors, and I'm here to introduce Dr. Talia Thompson. Talia Thompson is a nationally certified school psychologist working with the Extraordinary Kids Clinic in Denver. Talia and I worked together at the last conference to present a session on special education and later worked on the AXYS Educational Guidelines Consensus document. I'm so pleased that she's here with us again. Dr. Thompson is an expert in her field and comes to you today with a wealth of information about early childhood school psychology, as well as information about early intervention services. Thank you so much for sharing your knowledge with us today.
Hi, everyone. My name is Talia Thompson, and I'm an assistant professor with the University of Colorado in the Department of Pediatrics and with Children's Hospital of Colorado with the Extraordinary Kids Research and Clinic team. I'm going to be sharing a little bit today about early intervention services for young children with X and Y variations. Here's a little overview of what we'll be talking about. We're going to define early intervention and talk a little bit about why it might be important to consider for young children with X and Y variations. We are going to talk about the current state of early intervention for children in the US with X and Y variations. We'll talk a little bit about how families can access their local services. And then I'll give you some recommendations from our AXYS educational guidelines for early childhood providers. And then, of course, we'll end with a Q&A session at the end. So to start with, what is early intervention? Early intervention is a series of services and supports that are available for very young children, babies and young children with developmental delays and disabilities, and for their families. The goal of these interventions is to reduce risk and to increase life success and success later in school. These are provided in multiple ways, so it's important to know the distinction. There are public early intervention services that are provided under federal law called IDEA, the Individuals with Disabilities Education Act, Parts B and C. And then there are also private options for therapeutic services for young children. In the public domain, for public US early childhood intervention services, it's really important that families understand there are two distinct services. So the first is our early intervention, or our EI services. And this refers to services for children under the age of 3. These are targeted to address issues for the child within the home and really aim to improve a child's ability to participate in the family routine. So the individualized plan at this age is called an Individualized Family Service Plan, an IFSP. And the whole goal of the program is that the assessments are in the home, services are delivered in the home directly with the families, often through consultation with parents, and teaching parents how to work with their child to stimulate development and mitigate any sort of potential developmental delays or risks. These programs are managed at the state level. So it's a federal law requiring this, but it's managed by the state, and it looks different in every state. Sometimes it's managed by the Department of Human Services, sometimes through the Department of Education. Now, when a child hits 3, they enter a new program, a new system. And this is called Early Childhood Special Education, or ECSE. It's also called Preschool Special Education. This is for children ages 3 to 5. And now, rather than delivering services or assessments in the home, we start to see children being served in their local preschool. The aim here, rather than trying to prepare a child to participate in the family routine, is now school and kindergarten readiness. We're preparing children to enter kindergarten ready to go. The plan name changes to an Individualized Education Program, or IEP. And this is the same program that will follow children up through 12th grade, providing special education. Rather than being managed at the state level, these are managed by local school districts. So neighboring school districts can have very different programming and different services. And so someone with an IEP in a neighboring school district might receive different services than your own child based on local policies. However, the systems are really similar, and even staff can overlap between these two systems. They're really provided by interventionists and therapists who specialize in very young children and how to stimulate development. So we have early childhood special educators providing early developmental stimulation or early academic instruction. We have speech pathologists, occupational therapists, physical therapists, mental health providers, and behavioral specialists, and a series of other services. What is very important for families to know, especially in the X and Y variations community, is that for early intervention, or EI, depending on the state, some medical conditions and some other conditions, including like prematurity or prenatal exposure to toxins, can automatically qualify a child for EI services, regardless of their developmental status. So some states automatically qualify children with X and Y variations for EI services, even if they're not showing developmental delays. However, when a child hits 3 and enters preschool, this is no longer the case. So at 3, a child, in order to qualify for an IEP, must present with significant developmental delays and a need for interventions. And this is really important. We hear this time and time again from families of young children that this can be confusing. So we really want to reiterate that some states pre-qualify X and Y variations, but only for EI and not in every state. So why do we care at all about early intervention? Well, the research is really clear. There have been decades of research that EI programs work really well, and it's due to the brain's early neuroplasticity. Young children are sponges, and they respond really well to an enriched environment, and that can be an enriched home environment or early therapies, early interventions, and preschool. And the research shows that in the general population, EI, or early intervention, can close the gap for children at risk. It can improve academics, it can improve social and emotional development, the ability to make friends and manage emotions. It can also improve the family system. The research shows that families who participate in EI show stronger self-efficacy and more confidence in their parenting and just higher overall well-being. But why is this important for our families of children with X and Y variations? Well, we know from research, from prospective studies, that we see a lot of developmental delays in our kids with X and Y variations. Not every child will have delays, but we do see 50 to 75% present in the birth to 3 years with developmental delays. This is primarily in the speech area. About 75% of children report needing some type of speech therapy because of delays in especially expressive language, including something called developmental dyspraxia of speech. We also see delays in motor skills. Again, not all children will present with these delays, but about half report needing motor therapies, and in particular, some delayed milestones like late walking, some decreased motor coordination, or low muscle tone. We've also heard from families in a recent survey that about 20% of families report delaying kindergarten for their child with an X and Y variation, which is significantly higher than the general population. About 5% in the US typically delay kindergarten by a year. And so what that just tells us is that our kids with X and Y variations may have a higher risk for not being prepared for kindergarten at age 5, not being ready to meet that those kindergarten readiness goals right away, and maybe needing a little more support. We also know that later in school, we see a high need for educational supports. So we see about 75% of our kids with X and Y variations present with reading disabilities or dyslexia. And then also an increased risk for speech and language disorders, motor skills, executive function and ADHD conditions, autism spectrum disorder, or mood and anxiety concerns. And all of these can interfere with our ability to access the curriculum and learn. And so because of this increased risk, we have data from a recent survey showing that about 71% of children with X and Y variations do receive an IEP at some point in their kindergarten through 12th grade years. So as they get older and enter school, it's likely that children will require some pretty significant educational supports in the school setting, which makes us think early intervention is a great fit, and we should be advocating for this whenever possible so that we can try to mitigate some of these risks early on during that age of early neuroplasticity in the brain. So we did a recent survey of children with X and Y variations under the age of 5, and we wanted to understand how are children being served through early intervention and preschool services at this time in this country. And so we saw a number of things. First, we heard from parents that a significant majority across all of the X and Y variations reported their child received some kind of intervention service prior to entering kindergarten. Over half reported receiving those public services through EI or the preschool special ed, and over half reported receiving private therapies through insurance or out-of-pocket costs. And then actually a large portion reported dipping into both services and receiving both public and private therapies at some point in that birth to 5 range. So when we looked at the public services in particular, we wanted to see how were children being served through the public services. We first looked at our infants and toddlers, so the respondents of children with very young kids. And here's what we saw. It's very interesting. We saw about 60% reported receiving some type of EI therapy. Almost 40% got more than one type of therapy. And speech therapy was the most frequently reported early intervention, which makes sense based on what we know about the risk for early expressive language delays. Now, when our kids hit preschool, our respondents reported a similar number. About 60% reported receiving some sort of preschool specialized education program. Again, this time over 40% got more than one type of therapy in the preschool setting, but speech therapy was again the most frequently reported. We also saw, starting at age 3, the introduction of academics instruction and direct social skills interventions being provided in the preschool setting. We asked parents also to report how much does your preschool teacher or your child's early childhood provider know about X and Y variations? What do they know about these conditions and how it might impact your child's learning? And what we found is that over half said their teachers or early interventionists knew little to nothing about X and Y conditions, which is why we've been on a push of advocacy lately, speaking around the country to early childhood providers about these conditions and how teachers and therapists can support young children. We also asked parents to report on their perspectives and their priorities. What do you want us to know about the early childhood experience? And we heard a couple of really important themes. The first theme we called slipping through the cracks. So parents reported this sort of idea that their child was getting missed in a couple of ways. One was missing the cutoff to qualify for services. So not either insurance not covering it or not qualifying for those public services because their child was at the borderline of clinical significance and their assessment scores just didn't quite meet criteria for receiving services. And also parents described a profile of invisible disabilities. So young children who had a shy or quiet temperament and maybe a language delay and really were not poorly behaved in the classroom, but in so doing, their teachers were missing some things. And so parents being concerned and not feeling like teachers were catching their concerns with their children. We also heard from parents this huge need for more public awareness about X and Y variations. Not only were there uninformed providers, so medical providers, but also teachers and early therapists that didn't know about these conditions, didn't know how to serve their children. But we also heard from parents that they were having challenges navigating the early childhood intervention services. They didn't know how to get the services. They didn't know if their child would qualify or why their child wasn't qualifying. And so they also wanted more information, which is what led us to put together this presentation, which is why I'm speaking today. We really want to support families in understanding what services are available to their young children with X and Y variations. So this slide is important. Here are some tips for accessing early childhood interventions for your child with an X and Y chromosome variation. And you can see there's 2 different tracks. So as we spoke about earlier, there are the birth to 3 services and the preschool services. And how you access them is going to change depending on your child's age. And then you'll have a transition between the two services when your child hits 3 years. So at the birth to 3 age range, we recommend that families contact your state's early intervention program. You can do this if you're concerned about your child's development, if you think there may be missed or delayed milestones, or you can do this because you have a prenatal diagnosis and you don't know if your child will have delays, but you want to do proactive or preventative intervention services. And when you call the early intervention program or you look on your state's website, you're going to want to find your local service. This is usually managed at the county level. So then you'll be asking whether X and Y variations are on your state's list of automatically qualifying conditions. So as I mentioned earlier, in some states, and this changes rapidly, in some states, X and Y variations are automatically qualifying. So for example, in Colorado, where I work, a child who's born with an X and Y variation will automatically qualify for at least monitoring of their development, if not more, like direct intervention with therapists, simply because there is a known and documented risk for future delay. And so a proactive approach is recommended. That's not the case in every state. So in some states, if you call, they may say, no, that isn't on our list of pre-qualifying conditions. And your child would have to present with a significant delay in an assessment. Either way, you can request a multidisciplinary assessment to determine their strengths and needs. And this doesn't need to be made through a physician for a referral. You can call directly, right to your EI department and ask for an assessment. Typically, the assessment is in the home, it's free of charge, and it's a nice way to connect with a team of specialists, more than just a special educator, but usually there's also a speech pathologist, a mental health provider, maybe a motor therapist on the team. Now, if your child does not qualify for services based on those borderline scores that we've heard about from parents, or services are delayed, or you're on a long wait list for services, we also recommend considering private options. Of course, this isn't an option for every family. There are costs to this, and insurance doesn't cover everything, but we do encourage families to look into private options if you're not finding what you can or what your child needs through the public services. It's also important because we know that some of the early speech language delays that we see in kids with X and Y variations are unique and specialized. Like this condition of developmental dyspraxia of speech is not always able to be served well or best by a public early interventionist because they may not have experience in this type of unique clinical presentation. And so sometimes it's worth your time to investigate by speaking with your physician about a possible speech therapist who actually has training and specialization in your child's specific condition, if that's how they're presenting. Now, when we hit age 3, everything changes. And so here you're going to be contacting your local child find office because this is managed by your local school district, so a smaller area. Again, you're going to request a multidisciplinary assessment, and you can call and make a child find referral yourself. It doesn't need to be referred by a preschool teacher or a doctor. You can call child find yourself of your local district and receive an evaluation. Often, again, these are in the preschool setting or in a child find assessment office, so you're out of the home more at this age. And here again, children must present with a developmental delay to qualify for these preschool special ed services. And so sometimes our children do drop services when they hit age 3 because they qualified automatically under EI or they made progress under the EI program. And now when they go to their local child find program, they're no longer qualifying for services. They're above the threshold, they've made progress, and they're no longer considered at a high risk. So if this is the case, we recommend families, again, consider private options, look into things covered by insurance or out-of-pocket therapies. We also encourage families to consider enrichment activities. You know, an enriched environment can be provided by families. So music classes, swim lessons, library story times, play dates, social activities, really intentional enrichment with your child. AXYS has recently put out an educational guidelines, and in that are some early childhood recommendations made by some specialists across the country who work specifically with young children with X and Y variations. So our speech therapists, our motor therapists, our psychologists here at Children's Hospital gave some suggestions for how early intervention teams and families of young children might target, intentionally enrich the environments across all developmental domains. So we have some recommendations for encouraging speech and language development, encouraging motor development, those pre-academic skills like early reading, and also the early development of social and emotional skills and self-regulation. So we highly encourage you to check out this resource on the AXYS website and share this widely with people working with your young children. In summary, what we've seen in the data in past prospective studies and also in our current survey data is that there are high rates of services, both early childhood and then later in school, for children with X and Y variations, especially in the area of speech therapy. But there are some unique things about X and Y variations and how they present in early childhood that can be challenging to navigate, like these subclinical profiles, this profile of an invisible disability, something you can't see automatically, and just a general lack of knowledge in the general public and in our providers. So what we recommend is parents can refer their child directly for an intervention assessment, either through EI or through the preschool special ed program, and pursue private therapies or enrichment activities to supplement as necessary. And we also recommend that you encourage your child's medical team and early intervention team to collaborate, to work together. There are ways that the medical team can provide information about the condition to your child's providers. And there are also things that your child's early interventionist can tell to your medical team about how the child is doing in a more naturalistic setting, rather than when they go in for a one-day assessment in a clinic. So we see a partnership as really essential. We also highly recommend you share those educational guidelines from the AXYS website with your child's early intervention providers. And I just want to thank all of our sponsors for all of our research, and of course, the University of Colorado and Children's Hospital, where we do all of our work. Thank you so much, and it was a pleasure to speak with you today.